More than 30 people in the country are sick because of a listeria outbreak, and 2 people have died. As we first reported here on CBS News Detroit, the outbreak is tied to deli meat. The FDA says some vegetables and salsa have also been recalled because of possible contamination.
And this is all part of a broader recall that started earlier this month with cucumbers. Joining us now to talk about it is the Chief Health Officer for Healthline, Dr. Jenny Yu. Thanks for being here today.
Thanks for having me.
So, can you start with just the basics of what is the risk of a listeria infection and who's at the highest risk?
Yep, I think that most people are at risk if you're, eating one of the contaminated deli meats or vegetables, but you're at the highest risk if you're pregnant, you're over the age of 65, or you're living with a chronic condition that involves weakening of your immune system.
All right, so deli meat and vegetables, salsa, that sounds like something that's in a lot of lunch boxes. How do you know exactly what to avoid, or should you just stay away from all of it right now?
Right. And I think the FDA has good resources in terms of what brands are involved and what are the markets and regions of the country that are at the highest risk in terms of the recall. So I would encourage the listeners, watchers to be able to use the FDA resource to find out that information.
You mentioned it's especially dangerous for pregnant women, and as I'm expecting myself, something I've seen a lot online is people think that if you microwave foods, that would kill a listeria contamination. Is there any truth to that?
Well, listeria is hardy. It creates a biofilm over surfaces and the meats and vegetables. Refrigeration alone may not be enough, but high heat and cooking it certainly can kill the bacteria. So there's founded evidence in terms of microwaving is okay. And I will also say, rather than eating a cold deli meat sandwich, maybe making a panini is a better choice now.
Let's talk symptoms. How do you know if you're sick? Is it similar to food poisoning?
Not quite. So you certainly can have the GI symptoms, but it starts off with a high fever after 24 hours of exposure. And you can have very much like a flu-like symptom where you get muscle ache or that flu-like tiredness. And high fevers can last without whether it's anti-fever medications being effective. And certainly you can have nausea and diarrhea and other GI symptoms, but really it's fever, it's muscle aches and cramping and that flu-like symptoms. And so if you have that, if you have those symptoms and you think you've been exposed because you've had a recent encounter with a deli sandwich or vegetables, it is important to seek care with and talk to your healthcare provider sooner than later to have it tested. There are blood tests and culture tests that are available to evaluate the exposure.
And of course, right now we're talking about deli meat, but as we mentioned, there's also vegetables, salsa, I think almond milk recently. It seems pretty wide ranging. Is there any single food group that is typically not associated with listeria?
No, I think like I mentioned, listeria is a hardy bacteria, and it depends on manufacturing standards, and it can live on all different types of food sources. So it's important to wash vegetables and fruits properly. It is important to clean your kitchen surfaces and your refrigerator often to reduce the risks. Just as the basic hygiene of making sure that you cook the meats at high temperature and wash and clean all prep surfaces on a regular basis.
All right, extremely important right now. Thank you very much, Dr. Jenny Yu from Healthline.